Bureau referred and looked at Act 977 and Act 1030. Both were codified by the Code Division Commission without revision to either act. Act 1030 did not amend the language of Act 977, and the acts were not in direct conflict. We will proceed with the hearing from the entities on their Act 977 request. With that, I'll move to Senator Hammer for the next question.
Thank you, Mr. Chair. Just to get me back in the thinking pattern, what is it you're here asking for today?
I'm here asking for UAMS to be able to add COVID vaccination to the list of required vaccines for our employees with religious and medical exemptions available to our employees as well.
And if you're not granted that permission, what happens?
According to the final rule of CMS on January 4th, if we're not in compliance with the final rule, UAMS will lose about $600 million a year in reimbursement for clinical services from CMS for Medicaid and Medicare services that we provide to our Kansans. And we will also lose $100 million in federal contracts. It's basically for our entire research mission. So if we are found in non-compliance, that will mean that we are not able to provide services for Medicare or Medicaid funded Arkansans. It will mean that our residency programs, which are funded by CMS, will cease to exist. That will impact a significant portion of our workforce. That will also alter the future of our healthcare providers. Those are the doctors and nurses who are going to be taking care of us in the future. In addition, we will lose a number of our programs that are certified independent on CMS. That would include our renal transplant program, our NICU program, which is almost entirely Medicaid-based. It will require us to shut down our level 1 trauma center. We have the only level 1 trauma center in the state of Arkansas. It will mean that we will also impact our ability to staff the VA, where we have a significant number of our faculty who practice there, as well as Arkansas Children's Hospital, where we provide all the faculty. And our educational programs would probably go away because they are all subsidized by clinical services.
And is not this actually under litigation at the federal level? Is this not one of the lawsuits that's been filed by the Attorney General to stop this?
There are lawsuits that have been filed. You know, there are three different final rules for OSHA and for healthcare providers, hospitals. The OSHA rules have been stayed. There's not been a stay on this rule.
But it's not been before the judge.
I'm going to let you get back in the queue. We have a lot of members on the queue, and I'm going to have to spread them up. Senator Schofield, you're recognized for the question.
Thank you, Mr. Chairman.